Alasiri njema mtazamaji, natumai umekuwa na mchana mwema jinsi nilivyomie. Karibu sana kwenye taarifa za Mbiu ya KTN. Jina langu ni Zubeida Kome. Mbunge wa zamani wa Makadara Benson Mutura ndiye spika mpya wa bunge la kaunti ya Nairobi. Mutura ameteuliwa bila kupingwa kwa kupata kura zote ambazo zimepigwa leo alasiri na wawakilishi wadi kwenye bunge la Nairobi. Hebu tutazame ilivyokuwa.
I want now to declare the winner after the tally. Scenario 1. Other members, the results from the first round is as follows. 1. Benson Mutura Kangara, 123. Abdi Ali Abdi, 0. Dr. Odingo Odhiambo Washington, 0. Mike Obonyo Guoro, 0. Alan Chacha Mangera, 0. Kennedy Okeo Gondi, 0. Other members, Mr. Benson Mutura Kangara, having attained 123 votes, hence having met the prescribed 2/3 threshold, I hereby declare Mr. Benson Mutura Kangara as the validly elected Speaker of the Nairobi City County Assembly. Consequently, honourable members, I hereby order the Chief Sergeant at Arms to search, find, and bring to the chamber the said person, Benson Mutura Kangara, for purposes of ascribing the oath to the oath of the office. You can sit.
Kwanza kabisa ni kuchukua fursa hii na kumrudishia Mwenyezi Mungu shukrani kwa kutupa nafasi hii ya kuja kuwahudumia wakati huu. Vile vile pia nataka kuwarudishia shukrani waheshimiwa wote wa bunge wa kaunti hii, manake nyinyi ndio wabunge wangu, nyinyi ndio wakubwa wangu, na nitawatii na kuwatumikia na tutafanya kazi pamoja. Kwa hivyo nashukuru.
Katika taarifa nyingine kuu ni kwamba Wizara ya Afya imeripoti visa vingine 580 vya maambukizi ya Korona nchini. Ni taarifa iliyotolewa muda mfupi uliopita na Katibu Mwandamizi katika Wizara ya Afya Daktari Masi Mwangangi.
People who have tested positive for the virus from a total sample of 5,458, all tested within the last 24 hours. This brings now to total the number of positive cases in the country to 29,334. From our cases today, 530 are Kenyans, whereas 50 are foreigners. 336 of them are male, while 244 of them are female. The youngest is a 1-year-old baby, and the oldest is 92. With regard to distribution of cases by county, Nairobi County leads with 375, Kiambu 53, Machakos 23, Busia 17, Mombasa 15, Nakuru 15, Kajiado 14, Kisumu 12, Lamu 10, Nyeri 7, Laikipia 3, Baringo 2, Kisii 2, Turkana 2, Vihiga 2, Garissa 1, Bungoma 1, Murang'a 1, Nyandarua 1, Siaya 1, and Trans Nzoia 1. We have provided a distribution with regards to the sub-counties from each county, and this will be availed in the statement. Today, we are delighted to report that we have 198 patients who have recovered from the disease, and from this number, 119 are from the home-based care program, whereas 79 have been discharged from various hospitals. And this therefore brings the total number of recoveries in the country to 15,298. And we continue to appreciate our healthcare workers for their excellent work done. Unfortunately, however, we've lost 5 patients to the disease, bringing our fatality count to 465. We have also gone ahead and addressed and anticipated the increased workload of our healthcare workers, And through the Universal Healthcare Coverage Program, we've been able to employ 5,000 healthcare workers across various cadres so they can relieve the anticipated heavy workload in this age of COVID-19. Regarding the mental health of our healthcare workers, the ministry continues to put in place a care line, a psychosocial care line for our healthcare workers, where we have a set number of psychologists deployed, ready to attend to any queries or any concerns or any remedies that are required when it comes to mental health. We've also employed, through the different medical associations, peer-to-peer mentoring of healthcare workers as they continue to fight the COVID-19 pandemic. With regard to occupational risk and safety, we are working with different organizations who are involved in the design of our workmen compensation package. This has been submitted to Cabinet and is awaiting ratification in order to be able to protect the welfare of our healthcare workers.
Na bila shaka tunatoa pole zetu kwa wote waliofikwa na msiba. Waziri wa Elimu Profesa George Magoha amesema mpango wa elimu vijijini haufai kutekelezwa kwa mtindo wa wanafunzi kukaa pamoja na kusoma jinsi walivyokuwa wakifanya madarasani. Magoha amesema wanafunzi watafunzwa stadi za kujimudu katika maisha badala ya mazoezi ya mafunzo ya ziada kutoka vitabuni. Waziri Magoha amesema hivyo wakati wa ziara yake katika taasisi ya mafunzo ya kiufundi RVTTI mjini Eldoret.
Community teaching was meant to teach those children in the locality where they live, with a teacher who lives among them. And I'm now hearing a lot of hot air. If you live in a group of buildings which is gated, that has about 30 children, and there's one teacher there, why are you saying you need PPEs? If you don't want to teach the children, then it's as simple as that. And this concept, which is a very noble concept, was brought up in order to engage our children. So you may be thinking that you are supplying information, but you are actually supplying disinformation. And it is very, very clear that even here in Eldoret, the onus is upon you and the government system, but instead of teachers earning money and staying at home, they should teach the children around them. Yeah. That's the concept. And I think when we said it, it was very clear. So why are we shifting it in the press? But having said that one, the other thing that is very, very disturbing, His Excellency the President decreed and allowed us to pay BOM teachers, which is usually not catered for directly by government. Our job with Dr. Bello Kipsang here is to ensure that that money is not stolen. So if we stepped back to confirm